Cyclophosphamide apprehension. The cyclophosphamide is an alkalotic agent, immunosuppressive, used for plenty of human diseases, including in immunological diseases, kidney diseases, and other liver diseases, CNS, and plenty of diseases. So there are plenty of apprehension among the global researchers. The dose of cyclophosphamide is 2 to 3 milligram per kg per day for 2 to 3 months. Or if you give 2 milligram per kg, you can give for 3 months. And if you give 3 milligram per kg per day orally, you give 2 months. So you can give other way, the IV cyclophosphamide in a dose of 500 to 750 milligram day per square meter per dose monthly for 3 to 6 months, depending upon if your patient's need and the diagnosis. And cumulative dose of cyclophosphamide is a concern. 160 milligram per square meter per kg is the total dose or cumulative dose, and the oral dose 2 to 3 milligram per kg is higher than the IV dose. And the non-compliant cases of the disease is severe, you give IV. So thereby total dose of the cyclophosphamide would be less in the IV dose medications. Its toxicities are marrow suppression, good amount of cases, 20-30% something, and thereby you have low count polymorphonuclear leukocytosis, the leukocyte count is reduced, leukopenia. You may have consequent infection, and in those cases your febrile neutropenia and they should be carefully observed. And transient reversible alopecia is possible. It turns normal, and the nail discoloration is possible. Hemorrhagic cystitis in a small subset of cases possible, and infertility is found in 2 to 5% of cases. Future malignancy by chromosomal damage is a concern for the global peoples. Thereby, they do recommend one course only in oral form or in IV form, and long-term apprehension is your infertility and malignancy. Actually, the global research doesn't show much what are the really malignancies, what are the percentage like, and amount of infertility and amount of its consequences are not much well defined. But people, the global the scientific leaders, they fail to agree more than one course of cyclophosphamide. But in nephrotics, if I say it's quite effective drug. It keeps patient remission for 1 year or so. In that way, it is more effective in medication than plenty of other immunosuppressives, and it is cost effective also, and then available throughout the globe in low and middle income countries. It's a safe drug, it's a good drug so far I feel, but people do not agree. It's almost like a levamisole concern, where the America and the North America, Canada, America, that do not have levamisole in their market because of its other issues, cocaine adulteration by levamisole something, and that do not have a trial much about the levamisole, and therefore they are saying, but now they say no, it's not that bad. The other people, Asian countries, African countries, we are using it, and without the result is very good. So cyclophosphamide may be one of the medications which needs this sort of trial in future.